COVID-19 confusion. It's affecting us all, so we asked what you wanted to know.
I have business insurance before coronavirus was even.
Are we set to lose a heap of money?
Most would have thought, oh, that would never happen.
Plus, how to spot the scammers.
How iPhoney is that?
And keep yourself safe. Don't miss Fair Go Monday on 1.
Kia ora, good afternoon. We interrupt normal programming to bring you a national address by Prime Minister Jacinda Ardern. She's due to give an update on COVID-19. We'll bring you that live as soon as it happens. A short time ago, we had confirmation of 14 new cases of coronavirus in New Zealand. That brings the total number of confirmed cases to 53. Well, most of those are related to overseas travel. 2 of the new cases don't appear to have any overseas link. We're now looking at the potential of our first community transmission. Today's confirmed cases are in Wellington, Auckland, Taranaki, Taupo, Waikato, Manawatu and Nelson. Let's go now to Prime Minister Jacinda Ardern.
Kia ora koutou katoa. I'm speaking directly to all New Zealanders today to give you as much certainty and clarity as we can as we fight COVID-19. Over the past few weeks, the world has changed, and it has changed very quickly. In February, it would have seemed unimaginable to close New Zealand's borders to the world, and now it has been an obvious step as we fight COVID-19. This is because we are experiencing an unprecedented event, a global pandemic that in New Zealand we have moved to fight by going hard and going early. I understand that all of this rapid change creates anxiety and uncertainty, especially when it means changing how we live. That's why today I'm going to set out for you as clearly as possible what you can expect as we continue to fight the virus together. The first really important thing to remember is that the vast majority of people who will ever have COVID-19 will only experience mild to moderate symptoms. But there will be some who will need more care. That's why we have to focus on one simple goal: to slow down COVID-19. Slowing it down means not having one big tidal wave of cases, but instead smaller waves, groups of cases that we can manage properly as they arise. That means we reduce the impact on health, on jobs, and on our economy. Some countries and places have successfully managed to do this, but it does mean we have to be ready to step up our action when we need to. Here's how we will know what to do and when. Already in New Zealand, we have warning systems to try and get ahead of problems and hazards. We all know and recognise signs that tell us when we have fire risk or when to reduce our water use. Today, I'm announcing an alert system for COVID-19. That alert system can apply to the whole country, but sometimes it may only apply to certain towns or cities. There are 4 levels to the alert system. At each level, there are things we need you to do to keep you safe, and there are things the government will do too. Alert Level 1 is where COVID-19 is here, but contained. In this phase, we prepare. The basics like border measures, contact tracing, and cancelling mass gatherings are all activated. You will see that this is where we have been when COVID first arrived in New Zealand. Alert Level 2 is where the disease is contained, but the risks are growing because we have more cases. This is when we move to reduce our contact with one another. We increase our border measures and we cancel events. This is also the level where we ask people to work differently if they can and cancel unnecessary travel. Alert Level 3 is where the disease is increasingly difficult to contain. This is where we restrict our contact by stepping things up again. We close public venues and ask non-essential businesses to close. And Alert Level 4. This is where we have sustained transmission. This is where we eliminate contact with each other altogether. We keep essential services going, but we ask everyone to stay at home until COVID-19 is back under control. It's important to note that with every level, supermarkets and essential services like access to pharmaceuticals will continue. Shop normally. If we do that, our supermarkets will have time to restock their shelves. We will use this alert system every time we update our cases, so you'll know if the status in your area has gone up or down or stayed the same, and what you'll need to do. Today, I am confirming that New Zealand is currently at alert level 2. That means the risk of community transmission is growing. And so to stay ahead and reduce the chances of the wave growing, we need to step things up. Now, we already have many of the measures for level 2 in place, but there are some that are new. Here are the things that we need from you. Today, we are asking people over 70 years of age, or people who have compromised immunity or underlying respiratory conditions, to stay at home as much as they can. That means we need friends, family, and neighbours to support our older New Zealanders and people who may be in this group by doing simple things like keeping in contact and dropping off food or other supplies. When you do, make sure you are not sick, that you are using good hand washing practices and you're keeping your distance. We also need everyone to start working differently. Many offices have plans for workers to work from home. Others have staggered meal breaks or shift-based working. We are now asking you to implement these plans. Now, we know not everyone can do this. We need and will continue to have health and emergency professionals, transport and delivery staff, supermarket and food production workers, and other essential people continuing on at their place of work. And there are some sectors where work from home is impossible. There are still steps these workplaces should take at the same time, like additional cleaning and physical distancing as much as possible. And finally, we are asking that you limit your movement around the country. This will help us track and contain any spread of COVID-19. That means cutting non-essential domestic travel. Every unnecessary movement gives COVID-19 a chance to spread. Now, for those of you who are parents or caregivers, you will have questions about schools and education facilities. At alert level 2, schools will be closed if there is a case that affects a school, as we have been doing to date. That may change if we move into higher alert levels. But sending children home at this stage doesn't necessarily reduce transmission in the community. But I can assure you, we are constantly monitoring these settings to keep schools and children safe. As a mum, I can assure you this is my key consideration. Finally, this is a time when I know people will want as much information as possible. It's also a time when there is plenty of misinformation. All of the advice from the government about COVID-19 and how it affects you is available at covid19.govt.nz, including more detailed guidance on this announcement. Till then, I know this current situation is causing huge disruption and uncertainty, and right now I cannot tell you when that will end. This alert system is designed to help us through that, so please do stay tuned and we will share daily updates, especially as alert levels can move from one level to the next in a short space of time, as we have seen elsewhere in the world. For now, I ask that New Zealand does what we do so well. We are a country that is creative, practical, and community-minded. We may not have experienced anything like this in our lifetimes, but we know how to rally and we know how to look after one another. And right now, what could be more important than that? So thank you for all that you're about to do. Please be strong, be kind, and unite against COVID-19.
OK, we're going to bring in our political editor, Jessica Mackay, who was listening to the Prime Minister there speaking. And Jess, she touched on it. These are unprecedented times. We may not live through something like this again in our lifetime. Let's first of all talk about the announcements she made. There are 4 alert levels now in the country. We are now at alert level 2, and that means that over 70s should be staying at home.
Yeah, I think it's really interesting, the point you make there. It is unprecedented times. We've got the Prime Minister directly addressing New Zealanders through the media, and I guess trying to offer some kind of reassurance to a lot of people at this really difficult time. Those 4 alert levels, at the moment we're on number 2, and that means for people over 60 they are being encouraged to stay at home. So these are the things that the Prime Minister would like to change. The advice is if you can work from home, do so. A lot of organisations are already doing that, but that's the official word from the Prime Minister now. And if you can, do things like shift work so that not everyone is in the office at the same time. She says there are exemptions, though, of course, for things like supermarkets, for things like emergency responders, people like that. So essential services, at things that we need to operate our daily lives, those will still continue. The other thing that the Prime Minister mentioned there was to limit your movement around the country. This is a big step for the Prime Minister. We've already had those border restrictions. We've seen those crank up over the week. Now it's in New Zealand as well. So they're saying if you don't need to travel around the country, please don't do so. So those are the big main things that the Prime Minister wanted to get across today. She also sent a message, we're going to throw down on COVID-19, basically saying we want to unite and send a message that we're in this together and to try and get through it. So a few words of encouragement, I guess, for Kiwis today as well.
Yeah, yes, was very genuine in her approach to the fact that we should all be looking out for one another. You mentioned the travel. That's going to have huge ramifications for Air New Zealand, which is already struggling. And the other point is schools. For the moment, schools are still open.
Yeah, and schools is a big one, and I think for a lot of parents around the country, they have been listening very eagerly and waiting for advice on this one. At the moment, because we are in that level 2, schools will still carry on. Because of that possible community outbreak, if there is a particular case in a school, like we saw down south, then that particular school will close. So at the moment, schools carry on like normal. That's the advice from the Prime Minister. She did say, though, to keep monitoring those updates, because if we do go to that next stage, stage 3, things could change. Shall I just briefly outline for you those different stages? We've passed stage 1 already, now we're in stage 2. 3 is if we get into increasingly difficult, if it becomes increasingly difficult to contain the outbreak, that'll be number 3. And number 4 is sustained outbreak. So that goes up another level, and that's when we'll be staying home and no one will be moving out, like we've seen in some of those countries overseas. So I think it's important for New Zealanders to know we're at number 2 at the moment, and there are some of those tweaks and changes that we need to make today.
Yeah, that's right. And as you mentioned, in Britain and things, they've shut down bars, cafes, gyms and all that kind of thing to get things under control. We won't be at that level until you said alert number 4, where we eliminate all contact. We stay at home until COVID is under control. What did you think of Jacinda Ardern's message there, Jess?
I think she was recognising that there is a lot of uncertainty for people, and I certainly have noticed that this week. We've obviously been reporting on this for a long time, but it has felt more like things have been cranking up, especially this week, and for a lot of questions that have been unanswered. This is a worrying time for people. You've seen people going out and panic buying and going to the supermarkets, and that's not because people are necessarily being selfish about their approach. It's because people are feeling nervous about things and perhaps not feeling like they had that reassurance. And I do wonder if having that message from the Prime Minister communicated directly will help some people in that. She also made the note at the end of that announcement there saying, look, get your information from official channels, really reiterating that. I know us in the news media, there are a lot of things swirling around that you see. She's saying to people, trust those official channels. That doesn't mean for us in the media not to ask questions and to get more clarification from the Prime Minister, but she said, please don't trust gossip and rumour, go to those official channels. And that's an important message for people who are looking for certainty or for looking for answers, because for most of us, or for all of us, it affects us in some way, whether it's the way we work, whether it's the way We can go and visit elderly parents or grandparents, whether it's the way that we can take kids to school. So I think this cuts to the very core of how we operate and how we socialise, and it's affecting all of us at this time.
Very right. Thank you very much, Jess. That's Jess Mackay, and we're going to go back to her again shortly. The announcement this morning is there is 14 new cases of COVID-19 in New Zealand. That brings the number of our cases to 53. Here's what the Ministry of Health's Director General, Dr. Ashley Bloomfield, had to say a short time ago.
There are 14 new cases of COVID-19 confirmed in the past 24 hours in New Zealand. The locations of these new cases are 4 in Wellington, 1 in Taranaki, 3 in Auckland, 1 in Waikato, 1 in Taupo, 1 in Manawatu, and 2 in Nelson. This brings the total number of COVID-19 cases in New Zealand to 53 confirmed, and we have 4 probable cases. Most of these cases are travel related, but as yet, in 2 instances, no link to overseas travel has been ascertained, and we continue to investigate. So, at this point, we cannot rule out a risk of community transmission in these cases. So, detail for each of the 14 cases will be on the Ministry of Health website as it is finalised. The website will continue to be updated as fuller information is received. We always knew that cases apparently not linked to travel would happen, and we are prepared for that. And it is now more important than ever that we continue our efforts to track and trace individuals who may have been in contact with confirmed COVID-19 cases and get those people into self-isolation so that we can contain any further spread.
That was the Ministry of Health's Director General, Dr. Ashley Bloomfield. Now for an update on the Kiwis who are on a cruise ship which ended up docking in Sydney. Let's go to Nicole Bremner, who's in our Auckland newsroom. Nicole, the Ministry of Health's Director General, who we just heard from there, he gave that update earlier. There's concern about these passengers that were on a cruise ship, the Ruby Princess.
Yes, Melissa, there is concern about that. There were 56 New Zealanders on that ship, and it left New Zealand 5 days ago. It had been to a number of ports here, and they have had 4 confirmed cases of coronavirus on the Ruby Princess when it arrived back in Australia. So the ministry expects that the 28 people who have already arrived back and are in self-isolation, they will have arrived in under the travel restriction that came into force earlier in the week, and that they are now tracking the other 28 who were also on board. They expect everybody will be in self-isolation, but on top of that, they say their contact levels with the ship and the personnel on board makes them all now close contacts, and they will, in addition to being isolated, they will also be receiving a daily visit from health authorities just to check in on them and to see how they're going.
All right, and Nicole, we've just heard that we are now in alert level 2 phase, which means that people older than 70 should be staying at home, and those with other problems should stay at home. It will be the first weekend of self-isolation for many people. What's the message from the Ministry of Health?
Well, we just heard from the Prime Minister there, didn't we, about looking after our elderly, looking after people, staying in contact, and the importance of being there for people and maintaining social contact. And that was very much the message from Ashley Bloomfield again today, that self-isolation does not mean social isolation. There are very clear messages around mental health and making sure we are all staying connected through social media, through the phone, and even visiting to drop off food and supplies, things like that, but you don't necessarily have to go inside. You can still maintain distance, but you can make contact. So that's very much the word that has been the underlying message for the last few days from Ashley Bloomfield, and it's been picked up again today as we just seek to clarify the situation and to reassure people just to keep on the path that's been set out by our health officials.
That's right, Nicole. And could we just recap Ashley Bloomfield's press conference today? 14 new cases in New Zealand, 2 without links to overseas travel.
That's right. We do think that one of those cases, we understand that the husband of one of the new cases has a lot to do with visitors or overseas travel. We're not quite sure what his role is, but he comes in contact with a lot of overseas people, we understand. So he is also being tested. And the other case, we know less about that. We just know that it's a person in the Wairarapa. So the ministry hasn't come out and clearly said this is a case of community spread yet, but that's clearly at the forefront, and there's a lot of checks around those cases going on now to find out more information.
Right, thank you so much, Nicole. Well, as COVID-19 brings world travel to a grinding halt, it's forcing the heartbreaking cancellations of bucket list trips, especially for those already fighting big health battles. Lisa Davies has the story.
Lloyd Sinton's immunity is basically as low as it can go.
I'm on a couple of drugs there that weaken my immune system substantially, probably a V8 down to a couple of cylinders.
The 68-year-old has been crippled by an inflammatory disease that's fused his bones together. He's been saving for years for a dream trip to Spain. Having to cancel is a huge disappointment.
It is for me because I've never done it. I've been very sick in 40 years in lots of ways, wheelchairs and all the rest of it.
He's not the only one in this position. This terminal bowel cancer sufferer has been forced to cancel a trip to the Gold Coast to make new memories with his 3 young sons.
I'm potentially operating on borrowed time, so a big focus for me is to create memories with the family.
They're going to the Marlborough Sounds to make memories for his boys to keep instead. Bowel Cancer New Zealand says that for many of us, we can just cancel our trips and go another time. But for some of their patients, they won't get another chance.
I'm certainly in that risk category, being immunocompromised, where the repercussions for me could be quite serious. So I'm certainly grateful for the community as a whole to be taking those steps to really slow down the spread.
He's not the only one who's grateful.
We don't realise how fragile as a human race we are now. We've got something we can't even see killing people.
And he's still hopeful that one day he'll get to see the world. Lisa Davies, One News.
And charities reliant on major fundraisers are scrambling to find other sources of income. Cancer Society branches throughout the country have had to can Relay for Life events, losing out on significant funding that helps keep services running throughout the year. Caitlin Ruddock has more.
A fundraising journey that began with the word cancer.
This is for my sister, Janine Kamangai Bang. So much courage and so much fight. It's part of a process, acknowledging someone who's not able to walk around with us.
The effort disrupted by another disease that starts with C. COVID-19 putting a stop to 13 Relay for Life events throughout the country.
It's like part of that grieving and healing process, so to find out that, it wouldn't be on was pretty upsetting.
It's a major source of income for local branches as well as Daffodil Day.
Well, we receive no government funding at all. No Cancer Society does nationwide, so it will be a big dent in their income.
A number of charities say they're taking a financial hit at this time and are concerned they won't be able to deliver on the services they offer. In Nelson, teams are coming up with ways to complete their fundraising efforts, even if that's doing laps on their own.
We've got a local running track down at Saxton, and so I'll start at 6 a.m. and see if I can do the 16 hours.
These donated goods now up for grabs in an online auction, including a playhouse put together by volunteers.
I don't know whether that includes GST or not, but it'd be about $1,500 we'll get in there.
While Meraka's gone ahead with her planned sacrifice.
Unfortunately, 60 Kiwis every day will be told they've got cancer. COVID-19 is not going to stop that.
But right now, she says giving money isn't as important as taking extra care.
Because people have got really low immunity in our community through cancer treatment, pre, post, while they're going through it. So they're terrified. So if you're feeling a little bit sick, stay home.
Government agencies are preparing advice for charities with an update expected next week. Caitlin Ruddock, One News.
We're going to bring back in our political editor, Jessica Mackay, who joins us from Parliament. Jess, the Prime Minister announcing a short time ago the country is now on alert level 2. Can you give our viewers some idea of what that means?
Yeah, so alert level 2, it's from 1 to 4, and what that means at the moment for alert level 2 is that for the things that will change is people over 70 are being asked to stay inside. It also means things like if you don't need to have physical contact with someone, please don't. If you can work from home, please do that. If you can have things like shift work in your system, that's a good idea. But she is stressing that things like essential services and things like supermarkets will obviously still be open. The Prime Minister also wanted to get the message across that for many of us who get this, they'll have mild symptoms. Now, we have seen many thousands of deaths overseas, but for many people it is just those mild to moderate symptoms. And what they're trying to do is for those people who do need that extra help to go into hospital, they're trying to keep it free and clear for those people so that our health system doesn't get swamped under. The other thing that the Prime Minister mentioned as well was around self-isolation. A lot of people are in self-isolation now, but they're trying to say that, look, even though you can't physically be together, please try and stay connected, try and reach out online, do the good old-fashioned thing and pick up the phone, because particularly for a lot of older people in the community, it is harder to stay connected in that way. I know I picked up the phone to my grandmother who I talk to very regularly, but it was nice to stay in touch that way, and a lot of her activities at her retirement village have been cancelled because of this. And so the Prime Minister mentioned we just need to stay connected and stay in touch with people, with neighbours, with friends, and we can do that with, as I say, the good old-fashioned phone call or doing it online through social media as well. So there were those messages that the Prime Minister wanted to get across as well.
Yeah, I think it's saying on the screen now. She was very strong on be strong and be kind. She also mentioned that, in February it would have been unimaginable that we'd be closing our borders, and now we're talking about even really shutting down domestic travel, aren't we? On alert 2, that means, try not to travel.
Yeah, and I think for a lot of us, we've got our heads down a little bit at the moment, and we're working quite hard here in news. So when she said that, it did make me think, yeah, she's absolutely right. In February, if the Prime Minister had said, oh, look, next month we're going to be closing the border, all of us would have laughed. Now that's become the new reality, and I think that's hard to adjust to all of those things. And as the weeks progress, things have just gone up a little bit, up a little bit, up a little bit. I know when I spoke to you last Saturday when we did our live special, we talked about it feeling like it was snowballing. I don't feel like that stopped. I feel like that snowball has continued all throughout the week. And we are doing things now that would have been unimaginable just a mere matter of weeks ago. So I think that's when the Prime Minister was talking about a lot of people feeling anxious and a lot of people feeling stressed. It's no wonder, really, when all of this stuff is changing around us and that things are happening really quickly. And as the Prime Minister mentioned there, we could go up to this level 3 and we could go up to this level 4. It's a possibility. And they'll let us know as those things change. And of course, we'll keep you updated on that. In a short time, the Prime Minister will be going into the theaterette, which is just through next door to me where I am right now. She'll be there with the Director General of Health. And they'll be answering some of our questions around all of this because the Prime Minister gave that address to the nation. But we'll be able to ask some questions, get some clarification around all of that as well. So the Prime Minister is in her beehive office at the moment, which is just on the 9th floor, just in front of where I am now. And she'll be walking down to come and answer some of those questions, not just for us in the media, but that we can give, obviously, to the public who are watching at home.
Yeah, and we will be staying on air for that, of course, Jess. And as you mentioned, information at this time can be quite difficult to get across. The Prime Minister was quite strong on making sure that we were getting information from the right sources. And I think that leads into things like, I know at the school ground or at schools, news travels pretty quickly and sometimes it is wrong. But at the moment, schools are still open.
Yeah, so schools are still open, and that will be a big message that will be getting to a lot of parents. Now, that'll be a relief, I'm sure, for lots of reasons, but also for the fact that now it just gives people some certainty, because I think there was a lot of speculation that schools might say, right, on Monday we're going to send kids home for a few weeks, we're going to bring the school holidays forward early, and that could be a possibility down the track, but it is not happening. So schools are still very much running like normal. Of course, if there is a COVID-19 case relating to a school, that school will be closed for a period of time, like we've seen happen here in New Zealand already. But at the moment, the message to parents is kids will still be going to school on Monday while we stay at this level 2 alert system. That's what will be happening. So a reassurance perhaps to lots of parents out there at the moment.
And the alert system she mentioned works that we will be, I guess, text messaged. It may go to the countrywide, or it may just be in your area, so you will be fully up to date on what you need to know for your region of the country.
Yeah, and she said that every time we give an update on COVID-19, which is daily through the Director General of Health at the moment, they will let us know what that alert system is. Now, if it stays at 2 for the next little while, people will become more familiar with what that number 2 means. If it goes up to number 3, for let's say, for example, Auckland, we will be alerted through those press conferences and also through official statements from the Ministry of Health, through the website for the Ministry of Health, and also through the Prime Minister. So what they are saying is, please keep to those official channels at the moment, because we now have the wonderful world of social media where a lot of information is passed around quickly, which is fantastic on lots of levels. But in a situation like this, it can cause a lot of uncertainty in this area. So the appeal from the Prime Minister is really just to try and stick to those official channels. Now, I can see the shadows coming through here. The Prime Minister and the Director General of Health are just walking into the theaterette behind me, and they are going to give an update. They are going to answer questions. It takes approximately 5 seconds for the Prime Minister to walk up to the lectern, but they will give us an update and answer all of the questions, so I'm going to head in there shortly.
Very good, and we'll catch up with you after that, Jess. Thank you. So as Jess mentioned, we are counting down to this press conference, a question and answer session at 12:30. We're in a few minutes away. We'll go live to that, but for now, the latest on keeping highly important trade routes open. Let's go back to Nicole Bremner. Nicole.
Well, more information through from the government this morning, this time from Trade Minister David Parker, who has confirmed that he and the Singapore government are going to keep the supply lines open between.
We're going to interrupt Nicole because here is the Prime Minister Jacinda Ardern.
Of the public and also the government at different points in that alert system. What I want to acknowledge is that obviously there is great interest in the system and the information provided today. So there is increased demand on the website currently. I do just want to let people know this will be available on social media, a range of different outlets, and will continue to be available throughout the course of the day and obviously the coming weeks. I also just want to anticipate what will be, I expect, a number of questions as to the practical impact for different workers, different workforces. Those questions obviously best directed at your employer in the first instance. For those who have direct health needs, please do look first at the website to see extra information about how it may affect you. Leave Healthline for those more immediate needs. This is one way that we can make sure that those who need assistance and support directly are able to get through. I say that having no information on demand on those lines, but certainly just anticipating based on what we've seen to date from new information in the community. For now, though, I'm very happy to take questions, as is the Director General of Health.
When you went to Rotorua this week, businesses were talking about needing to rely now on domestic tourism. You're effectively cutting that off. Are you expecting that you'll need to ramp up the business continuity package exponentially?
When I visited Rotorua, one of the clear messages from businesses was also go hard, go early. That will also help protect our businesses in the long run, and that's what we've done.
What are some of the risks to old people, I suppose, because they're now going to be people over 70 moving into effective isolation?
What we're saying to those who are over 70 years of age or have issues with immunity or some other underlying health conditions, that we are asking them to stay at home as much as they can. This is a simple measure that we can take to make sure that we limit the chances of their exposure to COVID-19. In turn, that keeps them safer and limits the resource that we might be needing from our hospital system.
Should people not travel domestically, and in what cases do you think they can?
We're asking people to be very practical here. In this level of alert, we ask people to reduce their contact with others. So really just ask yourself that simple question, is this essential travel? Reduce that contact. If you do need to travel, keeping your physical distance at all times.
How quickly can we move to alert level 3?
Daily updates will be provided at the time the Director General sets out the cases for that day. He will also indicate any movement in our alert system. That it could apply to local areas or it could apply nationally. You could move both up and down, and that could happen at a daily notice.
What takes to shift us to alert level 3?
As you will have seen as we set out, restrictions at level 3 are through heightened risk that the disease is not contained.
What are the implications for... not at that point. What are the
Sorry, I'll come to Jessica.
What are the implications for domestic travel for Air New Zealand with this announcement?
Air New Zealand have already anticipated some of these requirements. So what they're doing with their seating arrangements is to build physical distancing into their ticketing and seating.
And how closely will it be monitored? You know, effectively asking people don't travel if you don't need to. Will there be anything like road checks, or are we
are asking people to take responsibility for their own decision making here. If we move further up alert systems, then that will change. But right now at alert level 2, we ask people to take responsibility for their decisions and make their own judgments. But please keep in mind, the more contact you have with others, the greater the risk.
Is Whited Upper in Auckland on the verge of moving into that next level?
As we've said with this framework, you can have regions move up the alert level. The criteria we've given is if community transmission is occurring or there are multiple clusters breaking out. So we make those assessments as we have that information coming through. At this stage, though, all of New Zealand is at level 2.
Prime Minister,
I'll come into the front. There's good time for everyone.
Are you working on the assumption that there is some degree of community transmission at this point?
As you will have heard the Director General state this morning, we cannot rule that out. Obviously, Public Health have undertaken their investigations with those who have tested positive, but they are still investigating some of their wider contacts. So we're letting them do that job. Right now, all of New Zealand is at level 2. But as you've heard me say, we do need to be prepared that regions or the country could move to level 3.
Could we see a shift to level 3 in the case of just one instance of community transmission?
I'll let the Director General answer that question.
What we need to do is look at, of course, not just any evidence of community transmission, but also what's happening around the country and where it's happening. And if, for example, we have a person who has done a lot of travel around the country and we can't identify exactly where that community transmission occurred, then we may look at the whole country. But generally speaking, we would be looking first of all just at that local community.
I think what we need to remind people is that in everything we've done so far, we've been willing to move on risk. We've been willing to move early to preempt potential growth in cases and waves, and we will continue to do that as we apply this alert system.
You talked about schools. You talked about schools there and saying, look, kids will still be going back to school.
Yeah.
You have consistently said we're trying to move ahead of that at the moment. So that's still the decision kids carry on.
And there's some very specific criteria that has been developed by the Ministry of Education to give people a very clear idea of when that will change for their school in their area. And so in alert level 2, if there is a case attached to a school, the school will close. There'll be contact tracing, 72 hours of thorough cleaning, and then the school will reopen. If we have wider community outbreak, that guidance may change, but I want to assure people, my number one concern, of course, is the school, the people who work within it, but the children as well. Breaking schools up now may not, however, reduce community transmission.
What's the difference between community transmission and clusters that you're talking about? Why is a cluster not community transmission?
I'll let the Director General answer that.
Yes, so a cluster may be related to a specific case where there is a link of overseas travel. So you might have a family cluster or even a community cluster where you can clearly identify an overseas travel link. So they are two separate things, But then again, you may have a cluster that is around community transmission too.
At what point do you start shutting down places where people gather? So going one step further than the 100 plus gathering restrictions,
Yeah.
at what point do you start shutting down bars, restaurants?
We've already put out guidance, and actually the restaurants and bars have worked very closely with the Ministry of Health to put out very specific guidance at this stage of what they must do in order to safely continue to trade. It is very specific and detailed. But what I am clearly saying to people here today, at risk alert level 2, reduce contact with others as much as possible. If you cannot go out and maintain 2 metres of distance from others, then don't.
How is the Deputy Prime Minister going to be affected? How is the Deputy Prime Minister going to be affected by these recommendations for over 70s?
Obviously, the Deputy Prime Minister we consider part of our essential team and our core part of our government. And so, if I could just complete the question. And so, the Deputy Prime Minister will be continuing on in his role as business as usual, whilst applying the same kind of measures we are asking all parliamentarians to maintain at this time.
Simpkins is over 70, so shouldn't he be leading by example?
And as I've said, for the Deputy Prime Minister, he is part of our essential team. He will be continuing on in his work, but applying the same critical measures that we have asked others to take and to keep.
Only 2 days ago that the Deputy Prime Minister was saying that both he and David Parker may continue to travel overseas when needed in terms of trade relations. Would your expectation be that either that stops or in Mr Peters' case he wouldn't be doing that?
The government will not be travelling overseas.
What about other MPs? They travel around quite a bit.
Yes. I've spoken with the Speaker of the House this morning. My intention is that the Business Committee, that is where we have representation from across parties, will come together and formulate a plan for Parliament that fits with the alert levels that we have set. We are obviously in a recess that gives time for that plan to be worked through. I do expect it to be cross-party and for there to be consensus.
Will you be shrinking Cabinet at all?
I have been working on contingency. That means that Cabinet can meet at least all together virtually, even if we don't have everyone in the same room. So I do want to start mitigating risks by breaking down the number of Cabinet members who are physically in the same space together at all times.
You mentioned certain illnesses and immune deficiencies. These people shouldn't perhaps be going out as much as other people. Can you be more specific about what sort of...
I'll give us a general frame and then I'll hand over to the Director General. So we've asked all those who are over 70 or have compromised immunity or certain other health conditions. Those certain other health conditions and greater guidance is available at the COVID-19 website, so that will go into greater specificity. There is, though, going to be some medical judgment involved. Someone, for instance, who is a severe asthmatic, this will apply to, but someone who otherwise may have much milder respiratory issues, then would be asking that they consult with their health professional so that they can ascertain the best plan for them.
The comment I would like to make here is that there's an obligation on everybody around people who are either older or have pre-existing medical conditions, because you may not know the person who you are with. For example, if you go out and you are unwell, you could be putting someone at risk, someone who might be receiving treatment for cancer and is immunocompromised, someone who might have an underlying medical condition like a heart condition or diabetes. So the obligation is not just on those with those conditions or on older people, it's on everyone to make sure they are not putting those people at risk.
Cabinet and the government starts moving to a more kind of virtual working, what are you doing to mitigate security risks?
Security in what way?
So if you're not meeting together in a physical room, which is in lockdown where your phones are all banned, but you're doing things online more, how do we prevent hacking?
Yeah, and look, those are things that already within our Cabinet Committee structures, for instance, those are already utilised. So I'll just be making sure that I gain those additional assurances that all of those measures are in place.
Have you personally been tested just in case?
No. Again, I follow the same guidance that I ask the rest of New Zealanders to follow. I am trying to keep my physical distance from others. I'm frequently hand washing. I am reducing down my travel, as some of you will have already seen, and I've made the move to base myself here out of Wellington. Those are all measures I'm taking to make sure that I'm following the same guidelines that I'm expecting of everyone else.
How concerned are you that people just don't seem to be getting the message in terms of panic shopping?
I cannot reiterate this more clearly or firmly enough. We will continue to have food supply in New Zealand. The reason we have empty shelves is because our supermarkets are unable to restock quickly enough. When people panic buy, it doesn't allow time for restocking of shelves. It also potentially deprives someone who desperately needs a particular item from even being able to get one thing on their list that may be critical to them. If I can use an example, there'll be families who need formula. If we panic buy, that'll be a family who may need that immediately where it won't be available. Shopping must continue as normal. It will be available at every alert level. Even if we are in alert level 4, supermarkets will be open. We are working with supermarkets to make sure that that will be the case to support them to remain open. I say the same for pharmacies. Do not panic buy at pharmacies. Shop as you normally would. They will remain open and products will remain available.
With 1,500 tests processed yesterday, moving forward, do you expect that that many tests will continue to be carried out on a daily basis?
Oh, look, as you would expect, we are continuing to see those increases and we have the ability to increase capacity. Of course, there is more than just capacity though, there's people involved with all of those tests. So maintaining that is something that of course we continue to assure ourselves of as well. But just in terms of how many we're constantly assessing, it's as clinicians say people need to be tested, we are testing.
How much are you able to increase?
Do you acknowledge that we were too slow to start testing at capacity?
No, of course, as I said, that clinician discretion was there. We asked clinicians if they believed they needed to test, they did, and as you can see, they are.
How much are we still able to increase capacity by?
Well, we can increase the capacity of testing further if we need to. I just want to reiterate the point I make each day, that is, it is important that the right people are tested, and that means people who might be at risk of having COVID-19. Because it's not just the capacity in the labs and the swabs and the reagent, it is the staff in the labs, and they're working long hours. We want to make sure that we are using that capacity to test in a way that helps us identify cases and then contain.
Also, I think it is worth pointing out that Korea has been used as a real gold star in terms of testing, and relative to our population, I'm told that our testing rate is up there at the same level.
How long before you think you can...
You'll be aware that there are public health experts who say that unless we go to level 4 now, we're shutting the door after the horse is bolted, that shutting things down at the point where community transmission is confirmed is too late. Why aren't we there now? Why are they wrong?
And there are public health experts who have said we should be doing exactly what we're doing.
How long before Healthline is able to cope reasonably with the number of calls it's getting?
Sorry, how long?
Well, before Healthline.
Yes. If people who need to call Helpline are the ones who call, then absolutely calls will be able to be answered at a reasonable pace. At the moment, the majority of calls are queries rather than necessarily directly about someone's current health status or health needs. We have increased the number of people on those calls. We're able to take calls. We've also, with our non-urgent, using other parts of the government system to help. The boost you will have seen as part of our COVID-19 package had additional support and funding directly for Healthline.
New Zealanders are taking this seriously enough?
They need to. And I hope, if nothing else, that New Zealanders listening today will see that this is incredibly serious. We are in a position, a unique position, where if we move early enough and strongly enough, we can break down waves into much smaller clusters of cases. But it requires everyone to play their part. Government cannot do this alone. I'll come in front.
Dr. Bloomfield, I mean, how concerning a development is it that you can't trace the outbreak for these 2 people?
Well, obviously what we're looking for is if there is evidence of community transmission. Both the 2 cases are still under investigation. I think the key point here is this is why we are testing, is to find out whether or not there is community transmission happening, and the fact that there have been these thousands of tests now over the last few days, and so far there are just the 2 where we're still finding out if there is that international travel link, I think is important. But obviously the important thing is to find out early and then respond accordingly.
I think it is important to remember the magnitude of what we have asked. At the moment we have 2 cases that may potentially be community transmission. They continue to be investigated by the Ministry of Health. In the meantime, we have asked for people to cancel all non-essential domestic travel. We've asked people to work from home. We're asking over 70s and those with underlying health conditions to stay at home as much as they can. We are stepping up the response. We need New Zealanders to help us.
Maybe give an update, Prime Minister, on where NFAT is at in terms of flights, getting people home, that sort of thing.
I'll need to get the latest update on that. I haven't received one this morning, so my update won't be the most up to date. So let me go and do that for you.
All right. Just to clarify, are you asking MPs to follow your lead in facing South and Wellington?
And so this is why this morning I did speak with the Speaker. I want to make sure that the Business Committee, all of Parliament, comes together and makes some of these critical decisions. So MPs from across different parties to work through how we can make sure that government continues to do its job, the opposition is able to continue to do theirs, but that we are in line with the same advice that we're giving everyone else. So we're going to work through that together. We've got a recess which will allow us to do that. Just take a few more.
What's your message to young people who probably aren't at risk of dying from this, but are at risk of being quite prolific spreaders of the disease and perhaps aren't taking it seriously?
Yeah, and this is where the message of uniting against COVID-19 is so important. Just think about your grandparent. Think about someone in your family group or your friendship group who might have compromised immunity. It's not about whether or not you're worried for yourself. It's that you should be worried about those around you. So please take it seriously. This is about saving lives.
Why did you choose to do the statement of the nation approach to the information you've just given instead of the same way you've imparted all other decisions?
This is the first time we're introducing New Zealand to the alert system. So whilst from now on we may move up or down through the alert system, I really wanted to make sure that everyone had a clear insight into the entire framework. It's the first time we've shared it. It's the first time we've shared details around what it will mean for people. From here on, now that they have this information, they'll receive daily updates about where we're moving by either myself or the Director General of Health.
The Pandemic Plan and the Health Act actually provide for doing press conferences like this where you talk to all of us, not just one or two media organisations. It's about talking to the entire public, so shouldn't you continue to do it here?
As I am. That's why you'll see as soon as I finish, I've come immediately down here to face everyone and to answer questions. But this is about making sure that we can communicate with as many people as possible at once and then make sure that we answer all of the questions that will flow from that.
Dr. Why are we right not to go to level 4 now?
Because the current situation is, as outlined in the alert system, we're at level 2 and we believe that's the right place to be, and it's under very constant review. I'm talking very regularly with a range of health advisors, my own Chief Science Advisor and the Prime Minister's Chief Science Advisor too.
One thing I also think that we should remember is that this will be with us for some time. So we have to make sure that when we move, that we are able to sustain our response. This will not leave in weeks. It will be here for some time. Okay, I'll take last question.
Are DHBs going to restrict access to under 10s? We've heard of a case where an under 10-year-old was denied access.
Denied access to?
Clinic.
For COVID or for another?
Just a check, a routine check.
Oh. We might need more details on that. That sounds a little vague, but is there anything general you can say?
Just a general comment. All the district health boards are looking at ways they can, as soon as they need to, increase capacity. And so some of the things that they are looking at, of course, is deferring elective surgery and deferring outpatient appointments. But they're looking at alternative ways for the latter. It may well be they can do outpatient appointments through telephone or video conferencing. So that's what they're working on right now.
Last one. Sorry, you really have been waiting. Last one.
If the investigation into those two cases, the one in Wairarapa and Auckland, is unable to find any links to overseas travel, will those regions be put into alert level 3?
Oh, look, these are decisions that I leave with our public health experts, that exactly those questions are what they're working through now. They then provide us with advice and we move swiftly. So my message to everyone again, we are at level 2. We constantly need to be prepared that we may move very quickly up and down levels. It may be one region, it may be one area, it may be the whole country. Okay, everyone, thank you.
So a few more details from the Prime Minister and Director General of Health, Ashley Bloomfield. We're going to go back to political editor Jessica Mackay for a summary of this afternoon's announcements. Jess, New Zealand, fair to say we're ramping it up, we're stepping up the response again. Can you talk us through what the Prime Minister announced today?
Yeah, the message from the Prime Minister in there today was that this isn't going to be going away quickly. It's going to last for weeks, if not months. That's the Prime Minister and the Director General just leaving that press conference at the moment. And their message was just that we're going to have to prepare for this to last for a long time. The latest we got today is the Prime Minister has introduced 4 alert systems. We are on number 2 at the moment, and what that means is that people over 70 years old, they're encouraging them to stay at home and to self-isolate because they are the group that's most at risk. The message also from the Prime Minister is that schools will still go ahead. They will go to school on Monday, even though we're being encouraged not to associate in big groups. Schools are still on, and the message is that they will carry on. Now, if of course there is a COVID case in a particular school, then that will be addressed. But at this stage, for parents, the message is take your kids like normal to school on Monday. So that level 2, we could very quickly change into level 3 if that's necessary. But at the moment, these are the new precautions and the new systems that we're dealing with today.
It struck me at the end when she did mention this isn't going to be weeks, it's going to last a lot longer than that. And she also talked about the fact we needed to unite and that it wasn't the government couldn't do that alone. So what is she asking us all to do?
Yeah, one of the messages from the Prime Minister that she was very strong about was supermarkets. She said, please shop normally. Because I think what all of us are seeing, and for many of us experience going to the supermarket, is that people are buying and taking things off shelves far more than what they would actually need. And what that's doing is it's meaning that people who are coming in the next day or people who perhaps can't afford to bulk buy, they are coming in and there's not much left. Supermarkets are needing to restock. They can only do that so quickly. And what she's saying is, please shop normally so that supermarkets have a chance to replenish. Don't forget, a lot of products are available and made in New Zealand, and that our export and import links are still open. So even though those international flights for passengers and trips, we are still getting in those passenger planes, we are still getting those things that we need. And so the Prime Minister is really appealing to people to just please only buy what you need at this time. And that's a message too to your question, is that we're going to have to sustain this for a long time. So it's not, say for example, like a quick sharp shock where we'll be able to go in and deal with it quickly and know that in a little while it will stop and we can start to rebuild again. This is going to be a long time, and that's the message I think that lots of businesses are saying to their workers at this time, especially those groups that are working more intensely because of this COVID-19 in the health sector, for example, pharmacies, etc., is that you have to pace yourselves because this is going to be a long developing story and it's going to be months away until we see things start to return to normal. And that's a hard thing for all of us to get our heads around.
I think it is, and she talked about the fact that that young people maybe need to get on board, or that sectors that maybe have thought, oh, this is nothing to worry about, now actually have to take this very seriously. Can you just before we go, recap us on the numbers and cases so far here?
Yeah, that message from the Prime Minister is if you're not taking it seriously, you need to. So that number of cases has gone up 14 today, and the big thing that people need to take home and remember is that there is possible community outbreak. There are 2 cases there that they're not sure about, and there could be the chance that it's not linked to someone coming back in from overseas. So that's the big takeaway from it today. So another fast-moving story. We saw the Prime Minister deliver and address the nation directly today, then come in here and answer some more questions, and another exceptional Saturday here for us in New Zealand.
That's right, it is quite something. Thank you very much for being with me today, Jess. And now we've mentioned it a few times already, but it is important to repeat it again. The main points from this afternoon's announcement and what it means for you and your family. The country's now on what's known as alert level. We're on a 4-stage system. We're on alert level 2. Over 70s are being urged to stay at home, as well as those with serious medical conditions. We need to limit person-to-person contact, and workplaces should implement work-from-home plans. Plus, we need to limit all non-essential domestic travel. Thank you for joining us for this One News special. Updates are on our website. That's onenews.co.nz. We'll have everything you need to know at 6 o'clock. It's a lot to digest, we know. Have a great afternoon.